Okay.
There you go.
First of all, I just want to welcome everybody to the Resident and Family Support Council. It looks like you can't see me. There we go. To the Resident and Family Support Council. We do this every other week. And the purpose of this meeting is to empower people with information so that they can get what they need and want and deserve in long-term care facilities. And today's topic, we're actually going to be talking about the gift of empowerment. And so we're going to, that's going to be a great conversation today as we enter into this holiday week. And I also, at this time, I also want to take the opportunity to thank the Illinois Pioneer Coalition for letting us use their Zoom. They let us use their Zoom site all the time so that we can host these meetings, which is very kind and generous of them. So during this holiday season, I do want to make sure that we extend thank you to them for that. The other thing that I want to remind everybody, if you could please type your zip code into the chat, that just helps us understand where people are coming from around the state. We would appreciate that. And any questions that you have, please feel free to use the chat. We also, you can use the chat to share any resources for today's session that you want, because I'll be copying, doing a lot of copying and pasting. So we want our resource list to continue to grow. I also want to let everyone know that these are being placed on YouTube. So you can review these afterwards, or you can share them with friends. And then also on the Illinois Department of Aging website, you can access any PowerPoints and or resource information that gets shared during these meetings as well. And you're going to be getting all of those sites. Some of them are into the chat already. I know we've had Stephen put some of them in there already. Thank you so much, Stephen. And others will be on that information sheet that I will be sharing with everybody in a little bit. If you want me to send you the information sheet directly, go ahead and put your email address into the chat, and then I can make sure that I send it to you directly. Otherwise, it will be posted on our Facebook page as well as our website page. So you can access it that way as well. But if you want me to send this list to you, just type your email address. I'll make sure I get that and I'll send it to you directly. So without further ado, I'm going to go ahead. I'm going to pass it over to Carrie, who's a part of our planning group for these calls. Carrie, you want to go ahead and take it?
Hello, everyone. Merry Christmas. As we talk about empowerment, it has probably been what has helped me the most to get through the last almost 22 months, being able to educate myself, to be able to know when I went and spoke with others, whether it was about residents' rights or about CMS and how they worked, or worked with IDPH, the more I learned, the more empowered I became. It truly has been an eye-opening experience to learn how to get through this over the last almost 2 years, and to realize how much I could help others even by being educated and empowered. Probably one of the best examples of doing some of that is watching some of the residents that we've worked with since this has all started, whether it's my son or others, being able to use some of that to empower themselves. Recently, my son told somebody, "Oh no, I don't want you to come visit me. You're not vaccinated." And I was like, wow, he did that all on his own without mom needing to say anything or tell anybody. I thought, you know, for a 33-year-old adult who's developmentally delayed, that was huge. You know, other residents that I've helped that have now realized, okay, I don't have to wait for somebody else. I can file a complaint with IDPH. I can go to the director of my facility. I can go to my ombudsman, any of those things. Being able to teach people how to empower themselves has even been better than even what I have learned through this. So and one of the probably most helpful things is through all of it is learning where to go. So where Lee later on will discuss some of the resources of who you can contact and how you can contact people, that truly is the first step of knowing how to get someone to open that door for you. And because early on, none of us knew who to call, how to ask, any of those things. We all, especially family members and residents, we were in this blind together. So all of us that have taken this journey, we've learned something from it and learned how to move forward. Today, there's a couple of people joining us from the Jane Addams Seniors Caucus, and they will be teaching us and talking about empowerment also. I'm going to go ahead and turn it over to Inbal and let her introduce people and go from there. Thank you for joining us.
Thank you so much, Carrie. I'm just going to share my screen. Give me a moment. All right. I'll let Carmen take us away. Thank you so much.
Great. We are very excited about being here with you all today. My name is Carmen Betances, and I go by the pronouns of she and her. My position at the caucus is I am the Jane Addams Senior Caucus co-chair, and I belong to the Care Collective Committee and also the Housing Committee. Evelyn?
Yes, thank you, Carmen. Yes, my name is Evelyn Garvey. I am a member of the Jane Addams Senior Caucus, and I am in the Senior Care Alliance Working Group and the Nursing Home Working Group. My pronouns are she, her, and hers. Indal?
Hey everyone, my name is Inbal. I use they, them, theirs pronouns, and I am a staff organizer with Jane Addams Senior Caucus. Thank you so much for having us.
Great. We are a grassroots organization led by elders. We are inspired by the elders who have had an impact on our lives. Who is an elder that has had an impact on your life? Could you please take a moment to think about this and put your answer in the chat? Great. Our mission statement, Jane Addams Senior Caucus envisions a world where seniors can age in place with dignity, safely, free of ageism, racism, and other forms of oppression. And we will now speak about our different working groups, the housing justice, I am a member of the Housing Justice team, and we have been focusing on tenant organizing in senior buildings, preservation and deprivatization. And we have the language justice, for instance, addressing the lack of different language programming in CHA buildings, Chicago Housing Authority buildings. A national tenants bill of rights, a national homes guarantee campaign that ensures housing for all, and the passing and monitoring the senior safety ordinance, ensuring public health safety protocols in senior buildings in Chicago during public health emergency, such as the current pandemic that we are living in. And now we will show you some photos of us in action. And I will pass the Health and Economic Justice team to Evelyn.
Thank you, Carmen. The Care Collective is made of 2 teams, both of which I am a part of. In the Senior Care Alliance, our focus areas have been fighting for universal long-term care, which would allow people to draw on a public long-term care fund to pay for their long-term care. The Build Back Better Act that includes the strongest home and community-based services plan we have ever seen. We also have the nursing home working group. Our focus areas in this group have been popular education on the nursing home industry, collecting stories from nursing home residents and staff, building a campaign around improving conditions for the nursing home residents and staff. Now I will pass it to Carmen to discuss her motivation for getting involved with the nursing home working group. Carmen?
Great. And my experience was when my mom and I, or when my mom was a resident at a nursing home, and the experience was the lack of focus on the patients and information and supplies to the healthcare workers. My mother suffered greatly in the hands of a nursing home that should have been providing a safe haven, and she should have been cared for as a human being. She was dangerously neglected, and as a result, developed many unnecessary, painful medical conditions, and to be left to go without proper nutrition until the end. The inhumane conditions for workers and residents is the reason why I involved in the nursing home working group. And now I will pass it on to Evelyn again, and she will do the fair tax and fair revenue overview.
Thank you, Carmen. This is a fair tax and fair revenue overview, as Carmen just mentioned. In 2020, I was a part of our organizing efforts around a graduated income tax in Illinois to better fund the social services and address the state's deficit. The fair tax did not pass, unfortunately. However, we did have a majority vote here in Chicago, largely due to the thousands of seniors we talked to. In response to this loss, we organized with the Raise Up Illinois Coalition to tax the wealthy and corporations through the state budget in order to better fund social services. We won an expansion of the home and community-based services program in the state budget, among other social service funding increases. Now I will pass it to Carmen to talk about our Medicare for All campaign. Carmen?
Yes, Medicare for All. Our focus area has been in building the momentum to advance universal healthcare equity by passing Medicare for All. Among many things, Medicare for All would include long-term care coverage. I recently spoke at a rally in front of the Blue Cross Blue Shield building where I discussed my current enrollment in Medicare and the having to pay out of pocket for my dental care. The lack of funds led me to have infections and loss of teeth due to extractions. And my current situation is that the new and innovative implants or dentures have put an $8,000 quote for implants over my head. And I have no idea how I'm going to pay for this. And I know that I am not the only senior alone. Dental care comes second when you have to pay for food and nutrition. And now we're going to see a couple of photos.
All right, Carmen, if you want to talk about the healing circle. Yeah.
And yes, the Healing Circle, which is a space for the Jane Addams Senior Caucus and the Georgia members to share their stories, resiliencies, fears, grief, joys, and range of emotions they're experiencing. The idea for the Jane Addams Senior Caucus Healing Circle was born at the beginning of the pandemic following a virtual memorial space created for a dear member that passed, Mr. Frank Hill. And during the inaugural Healing Circle, members shared memories of Frank and found comfort in each other. Monthly Jane Addams Senior Caucus Healing Circles began in recognition of not only the need for connection during this unprecedented global pandemic and pivotal moment of civil unrest, but also out of the need to pause for reflection, processing, sharing, collective wisdom, and healing in organizing. Now we will talk about our electoral arm, JASIA. Jane Addams Seniors in Action is a political organization that works to elect people into office who will co-govern with seniors. We've endorsed and elected 4 people into office since we began in 2015, including State Representative Lakeisha Collins of the 9th District, State Senator Robert Peters of the 13th District, Alderwoman Maria Hatton of the 49th Ward, U.S. Representative Marie Newton of the 3rd Congressional District. Co-governance with legislatures includes regular access, regular communication on issues concerning JASIA members, a seat at the table when decisions are being made on issues that are important to JASIA members, and a relationship of accountability. Now I will pass it on to Evelyn.
Thank you, Carmen. I will now share my reason for involvement with the Jane Addams Senior Caucus. Some years ago, I was in a march in the Loop and signed up for information from the Jane Addams Senior Caucus. Being a member of groups like the Senior Care Alliance and the Nursing Home Working Group has allowed me to learn and to volunteer in several areas. It has been a great learning experience. I learned to understand the elements of the working group and its interacting parts. I learned firsthand how small groups working with limited budgets, but great dedication have made big changes. I learned the importance of influencing the opinion of those who decide legislation, whether canvassing or phone banking, texting seniors, and or lobbying politicians through letter writing and calls to their offices, and supporting candidates for office who share the values of the Jane Addams Senior Caucus. I have canvassed for the fear attack and have participated in processing the Chicago resolution for long-term care. I've been to City Hall several times in my blue Jane Addams Senior Caucus t-shirt to support the passage of the resolution. I've been to Iowa for the 2016 campaign rally. I am continuing to learn the meaning of the word Zoom on my laptop through participating in Jane Addams Senior Caucus conferences. I learned that the great majority of seniors wish to age at home with skilled and high-paid caregivers, and that the community care program needs funding to expand to take care of the growing number of seniors. And when the transition to a nursing home is made, how residents must be given the same high quality of care. I learned how this is all tied together in a tapestry of interacting parts, and that the work to make sustainable change needs to be carefully and systematically done. It has also given me the opportunity to understand the caregiving system for seniors, in which I am personally involved as a senior, and to understand care not only at the macro level, but at the micro level as well. I am very grateful for this experience. Now I'll pass it on to Carmen.
Great. And we are working towards creating a world that is safer for us seniors, where we all receive the care, housing, healthcare that we need of our choice, and are able to age with dignity, whether we are at home or in a nursing home. In order to make this a reality, we need you, we need us, and we need all. You could join us in our working group meetings, phone banking, canvassing, actions, writing letters, and many more ways. Imbal will drop a link in the chat for a form to get involved with us. If you would like us to reach out to you to learn more, please put your contact information in the chat or come off mute if you are on the phone. Jane, your caucus organizer, Imbal, will also stay on afterwards to answer questions about anything we have talked about today. Thank you, Lee, and thank you, Carrie, for having us here at the council today. And thank you all for joining us. Thank you.
Thank you. That's been really helpful and informative. Lee has a bunch of other resources that she's going to share with everybody, and we can go from there. Lee?
Okay, thank you, Carrie. Thank you so much, first of all, Evelyn and Carmen. It was really, I loved hearing how empowered you are. I think it's important that we all, during these meetings, we talk about this a lot. And we talk about how it can make you feel. And Evelyn, I think you said it very gracefully when you talked about how it was so important for you to do that. And so thank you so much for the work that you're doing. And do know, anybody, do please feel free. Imbal is a great human being. And she, actually your contact information, I did put the website link onto the resources that we're going to look at right now, so that everyone will have be able to contact you through that as well. So, so with that being said, I'm going to go ahead and I'm going to start our share with some of the resources that we have that we can be sharing today. So I'm going to do a screen share, and this is actually what the document looks like, if I can find it. Hold on one second. Of course, it's the last one. Okay. So this is just, can you see my, can you see everything okay there, Carrie? Can you see this?
Yes.
Yeah, I can see, Lee.
Okay, great. Just want to confirm that before I start looking at this stuff and people are like, what are you talking about? So we put together this listing, and it's actually up to 4 pages, and the gift of resources to empower. And we kind of categorized things. So the first thing was we talked about is a regulatory complaint related resources. So these would be the resources where you can go to get information on the regulations for the various long-term care facilities, as well as where you go to be able to make a complaint, or you need that advocacy piece happening for you on parts of the ombudsman. So the very first one is the ombudsman contact sheet. So the link is right there. Also, you noticed, I might have, and those of you who have been attending the meetings on a regular basis, I did put a QR code at the opening slides that you could just hold your smartphone up to, and it will take you to that link directly as well. I'm not going to share that because it's just a document that has the contact information for all the regional ombudsmen and the regional ombudsman, the regional areas that you can contact people directly to get any of your questions or get some of your needs fulfilled. The next document that I'm going to share, and I'm going to see if this will work. I think Stephen said he put it out there onto that World Wide Web someplace. So this is the next document. And Carrie, again, I'm going to ask you once I get it up on my screen if you can see it. Can you see it, Carrie?
Yes, I can.
Okay, great. So this here is the listing, and we shared the first couple of columns up until state regulations here. We shared that at a meeting, I want to say maybe it was like in May. And then what we did was we further enhanced another document that we had shared at another meeting that includes the regulatory agency and the advocacy agency on it. So what this does is when you get that link, then you can be able to click on any of these codes and it will take you to that federal law the federal regulation or the state law, the state regulation, the regulatory agency, and the advocacy agency. And you'll notice that some of the things that you're going to notice is that we have, and that independent living facilities are not licensed by the state. And that's a question that we get a lot. So there are no federal nor state laws and regulations regarding this. So this just can, and also this listing here on page 2, they have no federal regulations around them. So there's no federal laws in regards to assisted living, sheltered care, veterans homes, Illinois veterans homes, specialized mental health rehab facilities, medically complex for developmentally disabled, life care facilities and community integrated living facilities, and supportive living. So this is just has state regulations around them. So like I said, all you'll need to do then is click on the blue link once you get that, once you get these sheets. So I'm going to go ahead and I'm going to exit out of that one. And the next thing that I want to bring you to is we have a brochure that we actually shared in another meeting on electronic monitoring. I won't bring you to the brochure, but just as a quick reminder for everyone that you can't put cameras in your residence room. And it's you take on the cost. You can't have the facility pay the cost. And there's a whole brochure on that goes through and talks about your rights in regards to that and the process and the procedure for how you would move forward with that.
Lee, I'm going to interrupt just for a moment. Just because Fran just put a post up that she's not seeing the screen that you're sharing. Is that everybody else seeing what Lee is sharing? Could you put it in the chat just so we know, please?
Thank you, Carrie. So I'm hoping that other people are seeing this.
It looks like they are, yes.
Okay, good. Okay. I'm sorry that you're not seeing it. If you want to make sure that you put that into your your email address, I'll make sure that you get this directly. Okay. And I don't know what's happened, but it must be something at your end.
Some people are seeing it and some are not. That's even more different. I've never.
Okay. Okay. So I'll just talk through the titles a little bit more. That way, then hopefully people can feel a part of it. I'm curious if those same people could say, did they see the presentation that the Jane Addams Senior Caucus gave?
Hey, Stephen, would you turn your mic on and explain to Lee what you're seeing and what you're not?
So can you hear me?
Yes.
Yes, I can.
Okay. All right. So sorry, I'm in a coffee shop. So I could see the gift of resources to empower the whole time you've been talking, Lee.
Yes.
When you opened up the types of facilities and where to file a complaint and who can assist with advocating, I could still see the gift of resources to empower.
Got it. So it's not taking you to the website page.
Yes.
Okay. Okay. I'll see if I can work on that next.
Yeah,
So-
you probably, this is Kelly, you're probably gonna have to switch your screen
Yes.
and come off of that and go to the link.
Yep, that's what I'll try. That's what I'll do. So the next one then is the residents' rights booklet. And I'm going to go ahead and I'm going to click on that one. And then I will stop my share and I will do the new share. And that should then take me to that. This might get too confusing. So I might just wind up talking everybody through all of these because this might get too confusing for people. Because it's not coming up on there either. So I'm just going to go ahead and I'm going to talk through the resources and kind of just share what is good about those resources. If that's okay with everyone. I'm going to go back to sharing the gift of resources if that has not disappeared on us. Okay. So that way, then you could just pay attention to some of the things that we like about these sites and the reason why we picked these. The Residents' Rights Brochure booklet is just, it will take you directly to the booklet on the residents' rights, which is more the comprehensive residents' rights materials. That's a really great resource for everybody to have, particularly if you live in a long-term care facility or you have a loved one. So you'll know exactly, because some of these rights, the title of the right may be a brief title, but then it gets into more detail about what some of those rights look like. Like you have the right to use the phone in private. That's something that actually just came up the other day when I was talking with somebody. They were surprised. They didn't know that that was something that they could do. So it's important to understand those rights. And I really feel that everyone should become comfortable with that booklet and have that handy for themselves. The next resource then is the Senior Helpline. And this is the site that actually helps you locate services in your community. They evaluate your needs and answer questions. They link you to the local care coordination services, and they'll provide information and assistance and literature. So there you see the hours that they're open, 8:30 to 5. They have a toll-free number, their phone number, a fax number, and then an email address. So you can actually email them, and they can also provide you assistance. So that's great information to it's a good first step a lot of times to get you going down that path and help lead you to where you may need to go. The next site to bring attention to is the IDPH, the Illinois Department of Public Health site for filing a complaint. And that is also on that master sheet that I showed you, but sometimes we might forget these things. So if you keep this sheet handy, you'll be able to click directly on that. And when you click on that site, you'll be able to see there is an electronic form that you can fill out, and then you can email that directly to them, or you can print it and you can mail it, or you can even make a phone call. But I would encourage everyone to fill out that sheet to kind of look at the guidance on how to complete that sheet, because many times we hear from people, I filed a complaint with the Illinois Department of Public Health, and they didn't do any, they said that there were no findings. And that means that they came out and they couldn't verify. It doesn't mean that it didn't happen. It just means that they couldn't verify that that complaint existed. And unfortunately, they can't be in the building 24 hours a day, 7 days a week when they're investigating these complaints. And so what they see may be different than what we see as we file that complaint. So it's important that you really spell out all that information that they're asking, because the more you can give them in regards to that, the better they'll be able to go about and investigate that. So I think that that's provides a good guide, even if you're making a phone call complaint. I would encourage people to use that. Then there's a category that we put off as general long-term care information. There is a site called the Consumer Choice website. This Consumer Choice website is something that is done through the Ombudsman's office, and it was actually written as a mandated site that needed to happen several years ago. And what it is it's a site where the nursing homes themselves have to go into the site, and they need to put in information about their long-term care facility. And the information that they put into there includes specialized services that they may provide. And that could include bariatric care, ventilator services, dementia care, things along that regard. This is a nursing home driven site, so they have to go in and put that information in. You'll see once a facility does do that and abides by that, you'll find out that it really does give you a lot of really great, valuable information about the facility, including how many, one of the questions is about ADL care, activities of daily living, and the type of programming they have in regard to that, which can be important. So this is to really kind of help make some of those, give you more information about making some care choices as well. We are looking at trying to revamp that site to make it a little bit more visually appealing. So stay tuned for that. And we're trying to figure out better ways so we can streamline that information in a better manner for the consumer. The next thing is the Resident Family Council support. The Resident Family Support Council, which here we are today. And you guys all know they're they're on the first and third Tuesdays of the month at 3 o'clock. And all the previous meetings can be found, and the link will be there for you. So you can just go right to that link. And then also the YouTube link for those past meetings where you can see the recordings, including the recording of today's meeting is also listed on that site. Also, as FYI, we also have done 2 town halls through the Ombudsman's office so far, and you can also find the recordings on those as well on the YouTube page. And then the other site to share is a consumer voice. I know it gets confusing. There's consumer choice, and then there's consumer voice. Consumer voice consumer voice is actually a national consortium for consumers related to long-term care issues, and to really help empower people with information. And there's tools there for the consumers, for families, for caregivers, and for ombudsmen on this site. One of the things that I like about this site is if you really want to get into the advocacy work, there's some really great tools there for being an advocate, even in regards to how to reach out to your congressman or your senator, how to write a press release, things like that, that some of you may be looking at, especially after you heard the Jane Addams, you heard Carmen and Evelyn speak from the Jane Addams Senior Consortium there. If you really feel that you want to get empowered, this can be a great site for stuff like that. Then there's the advocacy groups. There, I included here as well. We had the ombudsman information up on the beginning of this document, but I also included the information for the Facebook page. The Facebook page is where you can kind of get more of that hot topic information. As soon as the regs published for visitation, which many of you, we talked about in the last couple of sessions, we put that onto our Facebook page so that you can get to that immediately. We put information up there, even just some feel-good information to help kind of keep us all motivated as we go through this pandemic world, as well as information on, there's actually a gift-giving idea that was posted last week on something that you can help do. You can give to a loved one that lives in a nursing home if you're looking for gifts that you can give them. Then there's Illinois Caregivers for Compromise. This is actually the group that Carrie, who spoke at the top of this hour, Carrie has been very involved in this Illinois Caregivers for Compromise. I really think that this was the group that got Carrie kind of off on her advocacy path. Am I right, Carrie?
Absolutely. That's how I got started. And
Yep.
I met people in this group and just kind of ran with it.
So it's a really good group, again, to help you really feel empowered. And the Facebook page is really the best place to go because that's where they do a lot of posting. And we do some sharing back and forth of information between the Ombudsman page and the Illinois Caregivers page, as well as the Consumer Voice page. So we really try to make sure between all of our Facebook pages that we are being very informational on those as well. And then here we have the Jane Addams Senior Caucus that Evelyn and Carmen shared with us a little bit earlier. And here's the link to their website that they did put in the chat as well. And when you click on that, if you're interested in volunteering, you'll see the information on that homepage about how you can go ahead and you can become a volunteer working with them as well. Inbal, am I correct in understanding that this is really a Chicago group, a Chicagoland area group?
Yeah, that's a good question. We are based in the Chicago area. However, we do take on statewide and national campaigns.
Okay, so if you live in the Chicagoland area and you want to be a part of this, please do not hesitate. I attend their meetings that they do on a monthly basis, and it's a great group of people that really, really fighting that ageism concept, because it's a great group of empowered individuals. Equipped for Equality, their mission is to really advance human and civil rights of children and adults with disabilities in Illinois. They can be that group that can come together and help with that advocacy when you feel like you've hit that brick wall. So this can be a really good, when you get onto their website, you really getting in and looking at their contact information. Then there's the Illinois Guardianship and Advocacy Commission. They help protect the rights and promotes the welfare of persons with disability. And what it actually is it's a board of 11 commissioners that come together and they don't get compensated for their work. And they really help make sure that the rights of people with disabilities, and that does include those that are aging in our world, they come together and they really do help make sure that that people's welfare is being taken care of. And one reason why this can be a really good group to go to if you do live in that independent living setting, which is kind of I mentioned there is no federal nor state regulations in regard to that. So independent living doesn't have that group, that advocacy group that can work with them. But the Illinois Guardianship and Advocacy Commission can be a great resource for you if you live in an independent living community and you feel that you need some advocacy work done for yourself. And then these are just some sites to empower with making some long-term care choices. Nursing Home Compare. This is where I really wish that I could share my screen with you. The Nursing Home Compare site is actually a federal site. And so you can, if you have a loved one in Maryland and they're looking for assistance in finding a nursing home, you can get on this site. I always say go to the .gov site over the .com sites or the .org site, because this doesn't have that bias of people that paid for good reviews. So what you find on this site is, if you've heard of the STAR system, there's a 5-star system. You'll find that information for every nursing home in the country. You can access the nursing homes by typing in your zip code, and you can put in how far you're willing to travel. And what it will do is bring up the listing of nursing homes in your area, and or in the area that you're inquiring about. And then what you can do is you could check on up to 3 nursing homes at a time. And then it will, when you click the next button, it will compare those 3 nursing homes side by side to each other. And things that it looks at is staffing, nursing home staffing ratios. It looks at quality of care issues, including how many residents in the building are reported to have pain, what their skin conditions are like, if they've had decline in activities of daily living. So you can really get an idea for what care issues that are important to you or your loved one. So this can really be a great site to make those empowered care choices. It also does give you a synopsis of the health inspections as well that you can access. The next site that I want to bring attention to is the nursing home inspection surveys. And this is the Illinois Department of Public Health site, where you, when you click on that link, it's a drop-down menu. You can find the name of the nursing home that you want to explore, and it will tell you who owns the facility, their annual inspection reports, how many complaint visits they've had against them. And it gives you information on the makeup of the building, how many people have dementia, how many people have mental illness, the age grouping of the nursing home, if they're over 60 or under 60. So it gives you the male to female relationship, how many percentage of males and females live in the building, things like that. So that can be a good site that can help you make that long-term care decision as well. And to go along with that is the Illinois Department of Public Health's long-term care informational page. You actually can access the site that I just spoke about, the access to the nursing home inspections, on this same link, but I felt the other one needed to also deserved its own linkage in case people wanted to just look at the inspections. But on this site, it will also give you information on advanced directives, information on Illinois veterans homes, which can be important to people. And then there's also a link when you can click on the quarterly reports of violators. And this will show you, when you click on that, the nursing homes that have had violations against them in the last quarter. And it's defined by, they have the most recent one is not the quarter we're currently in, it's the previous quarter. So let me see that these are reporting a quarter behind due to that's how the reporting system works. Another site to share, which is kind of along the same lines, is this Nursing Home Inspect. And I really like this site because it really gives you more of a database about those deficiencies, similar to the site where you have access to the Nursing Home Inspection Survey. But this one shows you more in a clear-cut way what those deficiencies look like. And you can look at this for the past 3 years up on that site. And it does stay, it feels like it stays more up to date than sometimes the state site feels. And that can be because you'll get a real good feeling there, knowing what it looks like when a nursing home gets a violation put out against them. The way the write-up goes is the exact write-up that the nursing home will get. And then what the nursing home has to do with that information is they have to respond to that on what their plan of correction will be in regards to each deficiency that they have. So that can be a really great site to explore as well, particularly when you're trying to make that long-term care choice. And the last one in this category then is the Illinois Pioneer Coalition's page. And they are the ones who host this Zoom site for us. And on this site, under the resource tab, is a resource called Your Way, How to Find Dignity and Choice in a Nursing Home. And you could either access the entire book, which goes through the whole process of making your care choices, what different types of facilities out there, what their definitions are, what's the difference between assisted living and independent living and skilled nursing home care and intermediate care, all the way to a resource about that is a checklist that you can have when you're actually going down to make that decision. When you go into a long-term care facility, you can bring this checklist with you and you can ask these questions of the nursing home so that you can find out how they provide their care, how they do look their dining looks, what their programming looks like, and what their staffing looks like, as well as what their environment looks like. And the basis of this questionnaire is not to look at the total, but to look at what's important for you as an individual. So that you're really making a person-centered care choice. And you're not just looking at a star on the federal site, you're also looking at what do you need, what do you want when it comes to your living situation. And just a couple of other things. One of the things we see a lot is, we get, I don't want to live in the nursing home anymore. What can I do? And so these are some resources here on this, under this category that can help you with that. There is a thing called the Colbert Consent Decree, and this is only for Cook County nursing homes. And this is for those people who live in a nursing home in Cook County who don't want to live in the nursing home anymore. And it's the object is that there have been people that have lived in the nursing home that are younger and they didn't want to live there and they didn't understand that they had a right to be able to figure out other how they could get out of their current living situation of living in a long-term care facility. So there was a case that came against the city, and this is the decree, so that there's actually resources out there to help you make sure that to navigate that path so that you, when you want to get out of the nursing home and not live there anymore, there's two links here. One is to understand your rights, who it is that's covered, and the other one is on the resources for that referral. So there's two links for that. There's another very, very similar decree called the Williams Decree that's for all nursing homes in Illinois for those people that have mental illness. And so they title it as residents living in institutions for mental disease, which we also refer to as SMRFs, support, I can't remember what they're called, mental health rehab facilities. And what's the first one? But a SMRF.
Specialized mental health rehab facility.
Specialized, there we go. Just had a brain, my brain just wasn't working. Thank you, Kelly. Thank you very much. So that's what this is for those people that do live in SMRF, and they would like to leave that they would like to leave that facility and move into a less institutionalized environment. And so again, two sites are provided here. One is to understand your rights and the other is for assistance so that you can have assistance in moving out of that facility. I also want to make you aware for Williams and the Colbert decrees that you can also contact your ombudsman. Know that the ombudsmen are there to help support you, and they will also help you navigate that pathway. We don't actually do the legwork in finding the residents that you can move to, but we will make sure that that referral happens to the right people so that you can get that process initiated for yourself. And then there's the Illinois Department on Aging's Community Care Program. And this is actually through the Department of Aging, as the Ombudsman program is through the Department of Aging. And that gets referred to as a CCP program. And what that does is it helps senior citizens who might need nursing home care to stay in their own homes. Because as even it was mentioned when Evelyn and Carmen were talking, people don't want to move into nursing facilities if they can avoid it for the most part. And so what this is, there are some services out there. If you meet these eligibility requirements, there are some services out there that can help keep you in your own home. And so this is a really great site to be able to go to for further information on that, to be able to get some home care, connect you with some community meal programs and things like that. And then there's United Way 211. And this actually was something that Carrie brought forward and I had never heard about, so I did some exploring on it. And what's cool about this one is that you could either connect with people through the online portal, or you can call them 24 hours a day, 7 days a week, which can really be helpful, especially if you feel like you're in a moment of crisis. And they'll help you locate in non-emergency situations. They'll help you locate any services that you may need, including locating those long-term care services that you may need. So it's going to be a really good resource for you as well. We've also included on your gift here today is the CMS visitation guidance that we've talked about in the last couple of meetings, and the link to that most recent one, as well as to the a consumer voice synopsis of it. That consumer voice synopsis of the guidance is really, really helpful, because the CMS visitation guidance, I think, is grown to be about, I think it's over 20 pages, and now it might be even in the 30s. So the synopsis from Consumer Voice, which we mentioned earlier, it has a really great, it can really be helpful for people. I'm finding it very useful for myself personally. And then also included with this is the Illinois Department of Public Health guidance, because once the Centers for Medicare and Medicaid Services, the federal government, initiates a guidance, the states take that guidance and then they personalize it for the facilities that are in their state. So the guidance very much mirrors the CMS guidance from the state, but this way then you have that there as well. And so we do encourage you to print these off if you're having any difficulty in having visitation, and really getting to know that stuff. And again, know that your ombudsman is here to help you in regards to this, particularly this week. If you're trying to go and see your loved one and you're getting any kickback from any long-term care facility, we are still standing at a place where visitation cannot be denied for anybody. So make sure you reach out to your long-term care ombudsman. If you do not know who that is, go right up to that very first link on this sheet, and it will take you right to that person so that you can talk to them and they can help you. We want to make sure that people get to see their loved one through the course of the holiday seasons. Other resources that just speak for themselves is Alzheimer's Association and AARP. Those are really two other really great sites. On the Alzheimer's Association, one of the things I want to point out about that is they do have a hotline number as well that you can call. And that is a 24-hour a day, 7-day-a-week hotline as well. If you feel that you need some guidance on dealing with your loved one that has dementia-related diagnosis. So those can be some really great resources for you. And then the last couple of ones are just some things you might want to kind of get on the mailing list for, or get the notices about them in your inboxes, in your email. One is called Caregiving Magazine. Recently, Kelly and myself, we were interviewed by this magazine, and it's for Chicago. It's Chicago focused. And we were really talking about the pandemic and what that looks like through the pandemic and visitation. I find this magazine can be really, really helpful for people that are caring for a loved one who lives in a long-term care facility. They talk about anything from how to communicate with people with dementia, to talking about a different advocacy that's happening. They'll talk about strokes and what does that look like. So it can be a really good resource for you. You can get that in print. You can register to get that sent to your house, or you can get it online. Also, there's Skilled Nursing News, and that's purely online, and they provide news and information that covers skilled nursing home. And again, you can subscribe to that so that can come in your inbox. And then I just added the last one out of the box, out of the chat box, and I'm going to be placing this into the document and someplace else, but it's the care plan information sheet. And we shared this at another meeting that we had. And this it talks about how the frequency of care plans for the different types of facilities. Are they referred to a care plan or a service plan? What are they, or an individualized treatment plan? So it can kind of help you navigate that path, the frequency of when these are supposed to happen. So that can be another great resource for you as well. So I have done a lot of talking. As you can see, we are onto 4 pages of all these great resources. And I'm going to stop sharing my screen right now and see, are there any questions that people have? We have just a couple of minutes left, or if anybody has any resource themselves that they want to share, please feel free to share that. You can put the link in the box and I can go ahead and add that to the sheet. Or does anybody have any comments or questions? If you did join the call just recently, if you wanted this sheet sent to you directly, go ahead and put your email in the box and I will make sure that I send this to you directly after this meeting. So did we have any questions? Stephen, do you know if we had any questions?
The only question we had was about if the document would be emailed out that I'm seeing.
Got it. Okay. Okay, great. Great. So what we'll do is, if nobody has any questions, I know I gave a lot of information. If anybody's looking for a particular resource for anything, please feel free as well. But with that, we are nearing the end of our hour. And what I will do is I can go ahead and I can end this recording, but I, as always, will be staying on. So if anybody has any further ideas or anything, please don't hesitate to open up your mic and talk.